Hi friends, happy Saturday. Today is June 8th and it's currently 11:45 in the morning and Austin and I just got done with breakfast. We had IHOP for breakfast. It was yummy. Was it yummy?
It was yummy.
Yummy. Okay, question of the day. Which of the following organizations protects workers and includes bloodborne pathogens and hazard communication standards and MSDS material safety data sheets? A, CDC, B, HIPAA, C, WHO, like WH, well, yeah, okay. And then D, OSHA. And I actually had my OSHA training, which has to be done annually in order to keep your license, yesterday through my school. So I know it's fresh information that the answer is OSHA. Correct. It says the Occupational Safety and Health Administration protects workers and applies to every workplace in the United States. OSHA's bloodborne pathogens standard protects professionals who are at occupational risk of exposure to blood or other infectious materials, which is definitely dental hygiene since we're like in your mouth making you bleed. If you have healthy gums, you don't bleed. But anyways, that's the question of the day. Today is super hot. Wait, what was the high again? 85-ish or something? 87. It's currently 81 degrees and we're heading to Target to get some meds that I have ready for pickup. And then we don't really know what we're gonna do the rest of the day, so I will bring you guys along. But yeah, just wanted to say hi. So hi, I'll talk to you guys later. Hello everybody, today is Monday, June 10th and it's currently almost 9 a.m. It's 8:48 and I'm about to get started. I have a lot of work I want to get done today. I just want to move forward and get a lot of like busy work done. Let me look at my planner. This week I have 4 chapters to read total, cumulative with all of my classes. And then I also have an assignment, another assignment, and another assignment. I have a lot to do this week, so I'm going to use my time wisely. Today is going to be a very focused day. I am manifesting that. Okay, let's look at the question of the day. I have it up. When periodontal probing, the clinician is touching the base of the gingival sulcus with the periodontal probe. The base is the blank. A, junctional epithelium, B, cemento-enamel junction, C, attached gingiva, or D, mucogingival junction. And the answer is junctional epithelium. Correct. Yay. The junctional epithelium is the name for the area at the base of the gingival sulcus made up of stratified, squamous, non-keratinized epithelium. In health, the junctional epithelium is located at the CEJ and becomes firmly attached to the cementum. So that's what that is. But yeah, I'm gonna get started and I'll check in with you guys in a little bit. So I hope that you have a great Monday and I'll talk to you soon. Hi guys, happy Tuesday. Today is Tuesday, June 11th, and I just parked at clinic. Today I have 2 patients and they're both like new patients. So honestly, my biggest goal for the day would be to get them both completed. But we'll see if that happens. I really hope so. So please cross your fingers and toes for me. I'm also praying to the dental gods that one of my patients today has a light quad because I need to fill that requirement. It's a summer requirement, and I'm starting to get really depressy about not completing it yet. We only have like 3 more days of clinic. Well, after this week, sorry, 4 if you count Thursday. But yeah, we just don't have that much time left, and I cannot afford to take an incomplete this semester. I'm not kidding. I cannot afford it. When you have an incomplete, when you get out of a semester with an incomplete, your financial aid gets affected as well. So I am stressing out. So please, let's pray and hope that today one of my patients has a light quad. But yeah, aside from that, I don't really have any news. I'll let you guys know how my day goes later this afternoon. And I hope that you have a wonderful Tuesday. And I miss you guys so much. And yeah, okay, I'll talk to you later. Okay, guys, hi. It's Tuesday still. It is 5:20 in the evening. I am just now leaving the clinic building. Today was a challenging day, if you will. This morning I had a patient who was a new patient. I had to do a screen and treat, a full FMX, like the whole 9 yards. And it was my first time doing a whole new patient with the screening, like in my appointment for only 4 hours in the summer. Like, sorry, that was a little wordy, but this was my first time doing what I did. And I just wasn't as efficient or as quick as I wanted to be. And so, long story short, without boring you guys with the details, I did complete my full assessment, but barely. Like, I really did use the whole AM clinic, which is just sad to me because I was really hoping to get to the cleaning. Second, my patient ended up being a simple for the calculus load. So simple quads don't count for graduation requirements, so it's just like unfortunate. And then my day gets slightly more challenging. This afternoon I had a patient. It was a new patient, full FMX, but she already has been screened, and honestly everything went pretty smooth with this one, aside from just still not being like quick enough. So I don't know how to change that, but yeah. I completed everything. I completed the assessment and the full debridement, polish, floss, fluoride, the whole 9 yards. But this patient was a simple, so none of the quads counted to my graduation requirements, and I still have not reached my light quad requirement for the summer. I'm just feeling really overwhelmed. I need to hit this requirement, and I don't know how. And you know, the faculty is hard on us because they really want us to succeed and like prioritize ourselves in this education, which I feel like I'm doing, but it's just, I'm so hard on myself. I don't want to cry. I'm just like stressed out, you guys. I'm gonna listen to some music and go home and hang out and just like chill out. Yeah, I am going to come on Thursday ready to conquer the day and hopefully have a good day. Yeah, I don't know. That's it. I hope that you guys have had a great Tuesday, and I'll talk to you either later or tomorrow. Bye. friends, happy Wednesday. Today is June 12th and it's currently 8:45 in the morning, and I am home today and gonna be working on assignments and stuff all day, but I just wanted to hop in here and say hi and let you guys know that yesterday was really rough. After I talked to you guys, I spent my entire drive home just pretty upset and stressed. I'm doing better today. I'm feeling very motivated. I posted to Nextdoor and Facebook and Instagram, and I created a sign-up genius with my fall clinic schedule, and Austin is being super super and my close friends are, so it'll be okay, but I'm definitely stressing out about hitting these requirements. Also, in the midst of all the craziness yesterday, I forgot to read you guys the question of the day. So let's do that together real quick. I probably don't know the answer. It says, the condition where a drug, in this case local anesthetic, becomes less effective upon repeated administration. A, tachycardia, B, tachyphylaxis, C, tachyarrhythmia, D, tachyon. I'm gonna say B just because I know tachycardia and tachyarrhythmia are not the answer, and then tachyon doesn't sound right. I don't know. Let's see. Okay, so I was right. In the case of local anesthetic, tachyphylaxis is when, if the patient needs more anesthetic for pain control, the doctor administers another dose and the patient still remains in pain because the anesthetic didn't really take effect the second time around. This can occur when a dental procedure goes longer than anticipated and the patient needs more anesthetic given. If a patient complains of pain, tachyphylaxis is more likely to occur since the nerve has regained some sensation prior to the administration of the second dose. That makes sense. Today's question of the day is a radiology question. It says, which error results in a white curved opacity on the radiograph and occurs when the PID is not aligned over the center of the film / sensor? I actually had this happen yesterday, so I'm very aware of what it is, but A is closed contacts, B is cone cut, C is herringbone, D is missing apices, and the answer is cone cut. Correct. A cone cut is a curved opacity on the edge of a radiograph which obstructs the image. To fix a cone cut, simply realign the PID to directly face the sensor, ensuring that the entire area will be captured. So what happened yesterday, I was doing a molar bite wing on the right side of a patient, and when my patient bit down, the sensor moved up or down in my little ring, and I took the picture, but because the sensor was right here and the PID was here, it only got the lower teeth and a tiny bit of the upper teeth. I didn't even hit interproximals. So that did happen yesterday. I fixed it and everything was fine, but yeah, that's what that is. Yeah, that's pretty much my only update. So I'm gonna work now and I'll check in with you guys in a little bit. Bye. Hi guys, happy Thursday. Today is June 13th and it is currently 7:16 in the morning and I just parked at clinic. I'm here kind of early today. Today I have a patient in the morning and then a clinic duty in the afternoon. I am pretty confident that my patient today is going to be a simple, so I'm not gonna even like hold out hope that they aren't, because I'm pretty confident they will be. But as you guys saw, yesterday afternoon I spent over an hour calling patients that I've never met before on like my pass down list, and I also created a sign up genius for my fall clinic semester, and I was offering that to like a bunch of people. So I just sent it over to everyone that I called, whoever answered the phone, as well as just like other patients that I've had. And I have had maybe 5 or 6 people check their schedules, check the sign up genius, and officially get signed up for a clinic session in the fall. So that's good. That makes me feel good. I'm kind of getting on it already. Also, I was gonna say something. Right, so I am feeling really stressed out. I like have not been okay this week. I had a big mental breakdown after clinic on Tuesday. I like spent the whole drive home bawling my eyes out, and then had a really rough evening, and honestly a pretty rough like Wednesday morning. I'm just feeling really stressed out about this last requirement that I have to hit, which is the light quad requirement. But I did get a patient on Tuesday morning who I'm really hoping will fill that requirement. And my patient like Tuesday afternoon next week, I've never met before, so that patient hasn't been in the dentist in over 2 years. They could also fill the requirement. And then next Thursday are 2 of my friends who also could possibly fill the requirements. And then the following Tuesday, the 24th, is my last clinic day, and I only work half day. And it was actually supposed to be my mother-in-law, but yesterday, a member of my school that works in the clinic building emailed me letting me know that a patient has been assigned to me for that last day. I'm not sure if this person is, you know, gonna fill that requirement. I do need to check on that person's chart today just to see like what happened during the screening and what everything looks like. But yeah, I have her, I don't really remember, scheduled for my last day, so I guess there's like a final fighting chance. But you guys, why is this so hard? Why does everyone take such good care of their teeth? Like, stop it. I'm just kidding. Or am I? I don't know. Oh, I'm just like not in a really great headspace right now, but I'm gonna keep fighting. I am here. I'm giving it my all. I had this moment yesterday. I'm so freaking proud of myself, you guys. And you guys are a big reason why I feel that way. I feel so supported by all of you, and the fact that you are like pushing me to continue. Guys, huge. I really do put on a tough exterior, and you guys have totally seen me like break that down a little and get more vulnerable with you. But really, like really, I am a sensitive ass human, and I hold myself to such a high standard that I feel like I'm like the worst, dumbest, biggest failure whenever something doesn't work out. Like it's just the way I am. If I could snap my fingers and become less dramatic, promise I would try. But this is just who I am, and I am really hard on myself, and I'm really scared to not succeed, and I really want to succeed. I'm just really appreciative of all of you guys. I would not be able to keep going without you and your support. I'm serious. So thank you a million times over. I'm going to keep thanking you guys literally every week at least once, but I just have been having a hard time, and I really want to keep showing you guys that when you fall down, you're supposed to just get back up. Good things happen to those who really freaking work for it. I am not, you know, I believe in like destiny. Like I think everything happens for a reason, but I don't really believe in luck. Like if you want something, it takes freaking work. I've been teaching my kids that. They're so young. And I literally have been like, you want to, Katya? She goes, I want a pink car when I grow up. And I'm like, you want a pink car? You need a good ass job. You need to work so freaking hard. And I tell them right now that they're in school, you know, they get paid for their grades. Very little, but they do. They get paid like $5 per A right now and like $1 per B and nothing for C's. And then starting in like, you know, middle school probably will increase the rate. But I told them, I was like, the reason you're getting paid is because this is your job. You are working right now. You should be getting paid for your hard work. Like, I don't know. I'm a huge advocate for people who work really hard, and I'm not a huge, like, it's not the same to cheer on somebody who just got lucky. Do you know what I mean? I don't know. At least for me, maybe I'm mean. I don't know, but I'm going to work my ass off, and that means that if this doesn't work out, if I don't become a hygienist, if I don't, you know, whatever my next endeavor will be, if it doesn't work out, it is not for lack of trying. I am freaking killing myself. I'm trying so hard. So I'm going to continue doing that. And I just needed to vent and tell you guys that you can do it. Get back up, cry hard about it, and have a good support system. You know, I have a decent support system. You guys are incredible. And then my biggest freaking support, Austin. Oh, I just wouldn't be able to do any of this without him. He's the best thing ever. And then obviously my babies, they're really freaking difficult to do school around. And I wouldn't say they're exactly like helpful, but they are one of my biggest support systems. They cheer me on so hard, and I'm very, very grateful for that. Either way, I don't really have anything else to say. Today should be easy. I'm really hoping I can finish my patient this morning. That would be awesome. No x-rays are needed, but I do need to do like a doctor's exam, a screening, an RI form, and then obviously everything else that goes into an assessment and a debridement. So yeah, it's gonna be long. Oh gosh. Also, did I ever update you guys that we stopped looking for houses? That lasted a week. It was really sad. I cried about that too. I want my like marriage to start. Like I want my grown-up life to begin, but everything's just way too expensive. The market is overpriced. The interest rates are way too high. So we're just putting a big ass pause on it right now, and I'm gonna kill it at school to be able to get a job and afford a house, hopefully. So I'm ranting now. I'm going to stop, and I'll talk to you guys at the end of the day, and I'll let you know how my day goes. Austin and I are gonna go with his mom to Costco this afternoon, evening, to get groceries and stuff for our party on Saturday. And then hopefully the gym tonight, and then hopefully bed, and tomorrow morning I have class. So I'll see you guys later today, and I'll see you guys tomorrow. I hope that you have a great day. We'll talk soon. Hi friends. It is Thursday still. It's 4:54 in the evening, and I just got into my car. This afternoon I had a duty. I was actually a screener for the first time ever. So I screened one patient. Very productive. And then I spent the rest of the time like helping out with the DA and the RA, cleaning instruments and just making sure everything was running smoothly. Okay, so I had quite a day. I only had one patient this morning, and my patient was a simple. My patient was a recare, but like she hasn't been in years. So it was like a recare, but like almost like a new patient. But my patient is in this field, and so I did have x-rays. I ended up needing to get 2 supplemental images that the doctor requested. Do you guys hear how windy it is? It's like crazy windy. I had to get 2 x-rays. So get this, I'm going through my assessment. My patient was a little late, no big deal, but she was a little bit late, so I start late. I'm going through my assessment. Well, I'm going through health history and vitals. I get that checked. And then it's time for her screening. So I get that done. And then I go through her assessment and I get everything done. And I sign up for the doctor's exam. The doctor comes in 15 minutes later and spends quite a lot of time looking at my very healthy patient's x-rays. That was wild. Like, I'm very appreciative of the doctor being thorough, but like, this was, I can professionally say that this was excessive. So the doctor looked at her x-rays for like 10 whole minutes and then got into her mouth and did his like oral cancer screening and his checkup, his comprehensive exam, and then asked me to take 2 supplemental images, but told me not to worry about like signing up to get him again and to just go get him. So I take these 2 x-rays. The x-ray area was ready for me immediately, so I take them in like 5 minutes and get her back into my room, and then I go find the doctor and I let him know that I'm ready for him to come back. Guys, sadly, I'm not lying when I say that I waited 40 minutes. 40. And you can't get your assessment check until your doctor exam is complete, because you can't do your plaque index, your disclosing tab, until the doctor's exam is complete. Do you understand what I'm saying? So like, everything gets done, you do your doctor's exam, the doctor leaves, you do your plaque index, you sign up for an assessment check, you get your whole entire assessment checked. I got my assessment checked at 10:40. Maybe took 5 minutes. My faculty was like very quick and thorough and like efficient because we both knew we were running out of time. She gets done, let's just say at like 10:50. All patients must be out of the room by 11:30. She told me 11:15. I love that my faculty like pushes. I really hope that everything was caught on my video before it died. If it didn't, I'll check when I get home. If it didn't, I will let you guys know how my day went tomorrow. I'm so sorry. I really hope it caught everything I said, but pretty much I ended up having to complete my entire patient, a 4-quad debridement, in 15-20ish minutes, and I did it completely hand scale. Did not touch the Cavitron to her. In those 15 minutes, I not only did a 4-quad debridement hand scaled, but also full polishing and full flossing. So when I brought my faculty back in, she did a check on the calculus and on the debridement, and then I did fluoride and discharged my patient. So it was just like really crazy, a little bit chaotic there for, I want to say a minute, but it was like an hour and a half. And then I ate lunch so quick because I was running into, well, the issue is that I got done and out of my room at like 11:40, and we don't have to be back for huddle until 12:55. But I had a duty this afternoon, which means that I have to be there at 12:30. And so I got to the room where I eat lunch after warming up my food, and it was like 12:06. So that was a little stressful. So I ate really, really quick. And then I went and I was screener this afternoon. So now I'm in my car and I'm gonna drive home, and we're gonna go get some groceries for our little wedding after party on Saturday, and then gym, and that's pretty much it. I hope that you guys had a good day, and I have class tomorrow at 9 a.m. so I'll chat with you guys tomorrow. Hi friends, I'm sorry, I'm actually so embarrassed at how homeless I look right now, but I can't take this out quite yet because I need it to work, and I also don't have any makeup on right now because, well, first of all, I'm at home, and second of all, we have a wedding to go to this evening, and so I just like don't want to do my makeup yet, you know? But hi, it is Friday, June 14th, and it's currently 10:51. I just got done with my class, actually. We ended early for the first time so far. And today we kind of just went over the parts, the armamentarium. What is it called? Hold on, let me look because that word is fun. Armamentarium of syringes. So that's all we really went over, and then that's it. And then now I'm here. So I just got off the phone with Jordan. We just did a little, what is it called? A little catch up, if you will, because we don't see each other ever because the school decided to ruin our lives and split us up. But it's okay. Anyways, I don't really have an update for you guys, but I do have a question of the day. So let's look at the question of the day, shall we? The presence of what in sugar-free gum may decrease a patient's risk of developing caries? Oh my gosh, so I actually know the answer. A, glucose, B, dextrose, C, xanthan, or D, xylitol. And the answer is xylitol. Correct. The answer is xylitol. Chewing sugar-free gum for 15 minutes after meals can greatly reduce a patient's risk of developing carious lesions. Xylitol is incredible at increasing salivary flow and neutralizing the pH of the mouth. Bacteria such as Streptococcus mutans are unable to digest xylitol and are therefore unable to produce destructive acids, thus inhibiting caries formation. We actually learned that in fall semester, I think, from a rep that came to the school and talked to us about, I think that was our... I don't really remember what rep she was, but she gave out xylitol gum and xylitol mints and xylitol candies. And to you people out there, I do highly recommend it whenever my patients are asking me like for recommendations or anything. I do recommend like finding xylitol as an ingredient in their gum or, you know, their dentifrice products. So yeah. But I'm gonna go now. There's nothing else to really tell you guys. This is probably where I'm gonna end my video, so I will definitely try to record later when I'm getting ready for the wedding, and if not, then tomorrow, because we are throwing our taco party for our post-wedding get-together with our friends. It's gonna be so much fun, and I am excited to bring you guys along and invite you all to my party. So yeah, I hope that you guys had a good week, and I'll talk to you next week.